Welcome to Clinical Reasoning. In this course, we'll explore the concepts and strategies healthcare professionals use to make accurate diagnoses. We'll discuss pattern recognition, hypothesis testing, cognitive biases, and more. Join us on this journey into the world of clinical reasoning. Clinical reasoning forms the basis of medical decision-making. It involves integrating multiple sources of information, including patient history, physical examination findings, and diagnostic tests, to arrive at an accurate diagnosis and develop an appropriate treatment plan. This process requires a combination of knowledge, skills, and experience, as well as the ability to critically analyze and interpret clinical data. By understanding the principles and strategies of clinical reasoning, healthcare professionals can enhance their diagnostic accuracy and improve patient outcomes. Diagnostic decision-making is a complex cognitive process that involves gathering and analyzing clinical information to reach a diagnosis. Healthcare professionals employ various strategies, such as deductive reasoning, pattern recognition, and hypothesis generation, to narrow down potential diagnoses. However, several factors can influence diagnostic accuracy, including cognitive biases, time constraints, and the availability and reliability of diagnostic tests. Understanding these factors is crucial in minimizing diagnostic errors and improving patient care. Pattern recognition plays a significant role in clinical reasoning. Healthcare professionals develop expertise over time, enabling them to recognize common clinical patterns or typical presentations of certain diseases. This allows for more efficient and accurate diagnoses. Heuristic reasoning methods, such as the use of clinical algorithms and guidelines, can further enhance diagnostic accuracy by providing a structured approach to pattern recognition. Bayesian reasoning is a statistical approach used in medical decision-making. It involves updating the probability of a diagnosis based on new information, including the results of diagnostic tests. Healthcare professionals use Bayesian reasoning to weigh the likelihood of different diagnoses and make informed decisions regarding further investigations or treatments. Understanding the principles of Bayesian inference can aid in the interpretation of diagnostic test results and improve diagnostic accuracy. Effective clinical problem-solving requires a systematic approach, involving hypothesis generation and testing. Healthcare professionals generate a list of possible diagnoses based on the patient's symptoms and clinical findings, and then systematically gather additional information to confirm or rule out these diagnoses. This process involves critical thinking skills, clinical knowledge, and the ability to prioritize diagnostic investigations. By following a structured problem-solving approach, healthcare professionals can reach accurate diagnoses more efficiently. Cognitive biases are inherent human tendencies that can influence clinical judgments. These biases may lead to diagnostic errors and suboptimal decision-making. Recognizing common cognitive biases, such as anchoring bias and confirmation bias, is essential in minimizing their impact on clinical reasoning. Healthcare professionals can employ strategies, such as deliberate reflection and seeking alternative perspectives, to mitigate the influence of cognitive biases on clinical judgments. Clinical reasoning involves a balance between analytical reasoning, System 2, and non-analytical reasoning, System 1. Analytical reasoning is a conscious, deliberate process that involves logical thinking and deliberate reflection. Non-analytical reasoning, on the other hand, relies on intuitive judgments and pattern recognition. Determining when to employ each type of reasoning is crucial in clinical practice. Healthcare professionals must be aware of the strengths and limitations of each reasoning process and use them appropriately in different clinical scenarios. In the video, we will discuss the importance of thorough history taking and physical examination in the clinical reasoning process. Effective communication is vital, using appropriate language, terminology, and level of detail when conveying medical information to patients and colleagues. Diagnostic errors are common in medical practice and can have significant implications for patient outcomes. Understanding the common pitfalls that contribute to diagnostic errors, such as premature closure and availability bias, is crucial in preventing their occurrence. Healthcare professionals can adopt strategies, such as double-checking diagnostic decisions and seeking input from colleagues, to minimize diagnostic errors. Additionally, cultivating a culture of open communication and a willingness to learn from mistakes is essential in improving diagnostic accuracy. Technology, including clinical decision support systems, plays a prominent role in modern healthcare. Clinical decision support systems provide healthcare professionals with evidence-based recommendations and alerts to aid in clinical reasoning and decision-making. These systems can offer diagnostic suggestions, provide relevant research articles, and even integrate with electronic health records to assist in clinical decision-making. Understanding the strengths and limitations of clinical decision support systems is crucial in effectively utilizing technology to enhance clinical reasoning. Developing a thorough and accurate differential diagnosis is a critical aspect of clinical reasoning. It involves generating a list of potential diagnoses based on the patient's clinical presentation and then systematically narrowing down the possibilities based on further investigations and clinical data. Healthcare professionals use clinical algorithms, medical knowledge, and patient-specific factors to prioritize and refine their differential diagnoses. Mastering the skill of effective differential diagnosis is essential in ensuring timely and accurate medical decisions. Reflective practice involves self-reflection and critical analysis of one's clinical reasoning skills. By engaging in reflective practice, healthcare professionals can identify areas for improvement and enhance their diagnostic and decision-making abilities. Reflective practice may involve reviewing cases, seeking feedback from colleagues, and participating in peer discussions. It fosters a culture of continuous learning and improvement, ultimately leading to better patient care and outcomes. Congratulations on completing the comprehensive exploration of clinical reasoning. From diagnostic decision-making to cognitive biases, this video has shed light on the complexities of this crucial skill for healthcare professionals. Best of luck!